Thank you all for your presentations. Very, very interesting and some very useful analysis in it. Two things that jump out at me. First of all is the recommendation by Indecon that we should move to an open public competitive procurement model, and I immediately think the National Children's Hospital broadband cervical check, great model, what? Look at the results it's already given us, what a recommendation. But what I really liked was the challenge to the idea that we must move to a public procurement competitive model, because otherwise we would be flying in the face of perceived EU requirements on competition and policy rules. And I think you've put a very good challenge to that here. And what I'd like to see this committee doing, because I just said it to Deputy Brady there, we haven't actually done it, and that is to invite Indecon in to address their own recommendations based on the report that they give, because all of the boxes they tick in relation to the services that have been provided to reduce unemployment locally by all the schemes that exist there show fantastic results. So the one figure that does jump out is before the for-profit model of employment motivation, or employment, what would you call it, activation was brought in through JobPath, etc. Between 2012 and 2015, there was a 6.7% reduction in unemployment through these methods that you guys provide, as against, let's look at the reduction that has been achieved by Seetec or Toras Nua since then. And I think those figures would really beg the question of Indecon, where do they get this idea that we must move to public procurement? I want to ask one question though, and maybe one of the people involved in the Jobs Club could answer it, is that in the submission there's a list of the client group that present with multiple barriers and include, you go from limited education, no work history, homelessness, low literacy skills, age, distance, ill health and addictions. Disability is not included there. Could I get a comment on any ability programmes that might be funded, or how they're funded, or why they're not funded from anybody on the panel, and what actually happens in the question of disability? And finally, just to say that it's very, very clear that the model that you have presented to us is one that works with communities, that works with human beings, as against a punitive for-profit model that actually gives you an I. Daniel Blake result in very many cases. We've had evidence here very recently about how Seetec and Toras Nua is panning out in our communities. We've had witnesses in, we've had a scheme from Wicklow in describing the sort of detrimental impact of the privatisation of dealing with labour activation. It doesn't work. It's a for-profit model. It's not about the people. It's not about the communities. And clearly Indecon's report is telling us that the models we have get results, and if it's fixed, why try to, or if it's not broken, why try to fix it? I think it's because it is ideological, and it is this idea that we must do what the European Union tells us. We must do everything on a public procurement competitive model, and the evidence given here in your submission clearly refutes that, and I want to thank you for it.
Thank you very much, Deputy Smith.